Welcome to this mini lecture on Trochanteric Bursitis, which is aimed at medical student level. My name is Khabab Osman, and I am one of the registrars on the Birmingham Orthopedic Training Program and part of the Birmingham Orthopedic Network for Research and Education. Trochanteric bursitis is the most common cause of hip pain after osteoarthritis, and it is caused by inflammation of the greater trochanteric bursa. This bursa lies between the greater trochanter and the iliotibial band and is usually a thin layer of tissue but can become thickened and inflamed in this condition. One of the less common important differentials for trochanteric bursitis is a condition known as Meralgia Paraspectica. This condition is caused by nerve entrapment of the lateral cutaneous nerve of the thigh, which can lead to pain, paresthesia, and sensory loss in the distribution of this nerve. It is distinguishable clinically by the type of pain that occurs, as trochanteric bursitis can also have pain going down the lateral aspect of the thigh. Patients with trochanteric bursitis will normally complain of pain when lying on the affected side and often cannot do so at all. They usually recognize that the pain is present if they press on that part of the hip. And the pain usually gets worse with activities, especially when getting up from a deep-seated position, such as getting out of a car. This is because standing up from a seated position causes contraction of the gluteus maximus, which causes a lot of tension on the iliotibial band, and this can cause it to press up against the greater trochanter and also rub as it is subluxed from posterior to anterior during standing. On examination, it is possible to distinguish between trochanteric bursitis and Meralgia Paraspectica. Patients with trochanteric bursitis will exhibit tenderness over the lateral aspect of the hip around the trochanteric bursa, and this is almost pathognomonic of the condition. But you may also observe that they have some difficulty getting up from a chair. Conversely, patients with Meralgia Paraspectica will not have specific tenderness over that point, but may have some paresthesia or hypersensitivity all around the lateral aspect of their thigh. As well as history and examination described above, some further investigations can also be useful. Blood markers are usually normal in both conditions, but may be mildly elevated in terms of the CRP and ESR in trochanteric bursitis. X-rays are important to rule out osteoarthritis, and an MRI may identify inflammation of the trochanteric bursa, and in some cases also identify nerve entrapment of the lateral cutaneous nerve of the thigh, just under the lateral aspect of the inguinal ligament. Ultrasound scans are also equally useful, as they allow us to identify inflammation of the bursa and potentially even allow ultrasound-guided interventions such as injection. The diagnosis of Meralgia Paraspectica can also be supported by nerve conduction studies. The treatment of trochanteric bursitis can involve both conservative, medical, and surgical treatments. In conservative treatment, patient education in order to avoid exacerbating movement and avoid sleeping on the affected side can be useful. Physiotherapy can also be employed to allow stretching of the iliotibial band to prevent further irritation. Medical treatment such as Non-steroidal anti-inflammatory drugs and analgesia can be used to control symptoms. Steroid injections into the greater trochanteric bursa, performed either ultrasound guided or blind, done in the clinic, can help to damp down the inflammation and resolve the symptoms. Steroid injections are successful in a large proportion of patients. Surgical treatment is very rarely undertaken as the condition is mostly self-limiting or treated easily with the above therapies. But in rare cases, excision of the trochanteric bursa is done. The treatment for Meralgia Paraspectica can either be conservative with painkillers and injections, but surgical treatment is also possible in the form of release of the lateral cutaneous nerve. In conclusion, trochanteric bursitis is a painful condition of the hip with tenderness over the great trochanter on examination and can be treated with physiotherapy, steroid injection, but is usually self-limiting. Meralgia Paraspectica is an important differential diagnosis to be aware of, caused by lateral cutaneous nerve compression.